So you're ready to look for a senior living option, assisted living and memory care. You factored everything in. You looked at your budget, you looked at geography, you looked at the culture of the community, you looked at the amenities. So you're all set, you're making a decision, you're moving forward. Here is one thing that is incredibly important. A lot of folks don't think about this, families don't think about this, even seniors don't think about this, okay? Um, you really have to factor in the clinical and the healthcare element, okay? Here's what that means. Can that community care for your loved ones or your needs now and in the future from a health perspective, clinical perspective, based on specific diagnoses, based on specific things you may have going on? Um, so what I mean by now, of course, is there is an assessment that will have to be performed by whatever community you select, okay? Some communities are more selective than others, and that's based on a few things. It's based on their licensing. In Florida, there's 3 major license types, and it gives every community the ability to do or not do certain things. For example, oxygen injections, catheters, things like that are going to be restrictive to some communities versus others based on licensing. Beyond the licensing, it's also going to be their staffing. Do they have the staff to care for your specific needs? If it's a lot of care, can they do that at night, right? So most of them are pretty good in determining that on the assessment process. It is a subjective process, folks, meaning that they look at a objective criteria and they make a decision based on what they see and what they can and cannot do. It's not a perfect system, but there is a process behind it. But you, as the consumer, as a family member, for your loved one, or for you yourself, extremely imperative for you to factor the clinical element to your search, the licensing, the staffing. Because here's what happens if you don't do that, okay? You may potentially get a 45-day notice to seek a higher level of care if you didn't think about this, right? So you don't want to be in that situation. It could happen months after moving in, it could happen within a year. So here's what that means. As we know, aging, diagnoses will progress, can potentially get worse, just like dementia, right? So if you get to a point where, for example, you can't manage your own oxygen, you can't do your own insulin injections or different things like that, and now you need somebody to do that for you, meaning the assisted living or memory care community, and they're not licensed to do so, or they don't have the staff to do so, they will issue a 45-day notice to seek a higher level of care. What does that mean? It could be a different assisted living and memory care that has the licensing to do that, or it could even mean potentially a skilled nursing facility if they can't come through at all, meaning senior living is just not the appropriate setting anymore. So here's what I encourage you to do, okay? Factor that into your diligence. More importantly, work with an advisor like Northstar Senior Advisors that's going to give you the full spectrum and the full picture on what you should be looking for within your search. Budget, yes, what you can afford now and in the future, very important. Geography, culture, amenities, but then also the clinical and healthcare element to your search. Extremely important, folks. So again, don't do this on your own, and definitely factor all of this in so you can make the most appropriate option for your loved one. This is what we call proper placement. We're here to help. Northstar Senior Advisors, 407-796-1582.